I needed a team. I needed a group of specific specialists that could treat me individually, but also be willing and able to collaborate and cohesively come together as a united front to make the best decisions for my health. It took me 5 years to find my team.
On November 7, 2018, the second Interprofessional education event, Focus on Scleroderma, was held, hosted by Sage Colleges of Health Science. The goal is to engage graduate students from various disciplines and healthcare schools in an innovative and interactive exercise designed to coordinate patient care. 217 students from 6 healthcare disciplines attended this event.
My name is Andrea Fowler, and I'm an occupational therapy student. I'm a second-year student here at Sage.
So my name is Ronald Pills. I am a PharmD major, so I'm going to be a pharmacist, and I am in my second professional year.
I'm Brittany Barnard, and I am a dietetic intern with nutrition.
So my name is Dale Carhart, and I'm a physical therapy student, and I'm currently in my second year.
I'm Allison Trudeau. I'm a junior right now at Sage College of Albany.
My name is Kay Ciprilli. I am a student here at the Sage Colleges, and I am a first-year grad student in the Family Nurse Practitioner program.
Unlike other IPE events, this one included patients as a featured part of the program. The Steffens Foundation invited approximately 25 scleroderma patients to attend and interface with the students.
I was diagnosed in October of 2015.
I have had scleroderma for about 12 years.
I've been diagnosed 5.5 years now.
I'd like to introduce Amy Gydesen.
For those of you who are unfamiliar with it, scleroderma is an autoimmune disease that causes an overproduction of collagen in the body. Living as a person with a rare chronic illness has forced me to reevaluate my life, my goals, my friendships, my health, and how I live day to day. It took me 5 years to find my team. If it wasn't for their coordinated care in regards to my scleroderma and their willingness to work together and to bounce ideas off of one another, I would not be here tonight speaking to all of you. That's why tonight is such an important event for the disease scleroderma and for the patients.
The students were grouped to tables with one member from each discipline and were assigned to engage with each other and prepare interview questions for a hypothetical patient. The questions were later critiqued by an expert panel.
Another one was, what are some of the symptoms you are currently experiencing, and how has this disease progression changed your life, your quality of life? I thought those were very good questions too. I'm not sure what table that was from.
One of the panelists, Heather Friends, is also a scleroderma patient, and she spoke both from the perspective of being a patient and being an educator.
Talking with patients and talking amongst one another as a team. The first thing that's really important is to always make sure that you're really getting your patient's story, right? And that's not always easy. Patients come in with a story, but it's not always the whole picture. It's what they're seeing as symptoms. I think especially those of us who have scleroderma, sometimes we're having things go on in our lives and we're like, is this scleroderma? Does this have to do with this? So really making sure that you're, first of all, asking your patient a lot of open-ended questions. Tell me what's been going on. What other symptoms have you been experiencing? Tell me more about that. But then don't be afraid to follow up on that information that they give you, okay?
One patient joined each table for interviews and interaction with the students.
Because I really wanted to avoid my diagnosis, so I needed someone to tell me, this is what you need to do.
A panel of students, one from each discipline, was formed to interview Amy, using the questions created during their interactions with patients and with each other.
I just want to know, how are you feeling? Are you feeling okay? Today, yeah. That's great. That's great. Is there anything that has been bothering you more than anything was? Anything that you've noticed that's really been bothering you more than normal?
Well, I had foot surgery about a month ago.
Okay.
I got a staph infection from that surgery, so I was in the hospital for 3 days.
Okay.
So I wanted to ask you, how did you really learn about your condition, whether it be like a provider that was really great with you, the computer, sometimes people have peer groups or support groups. How did you really kind of hone in on it and figure it out?
Well, when I was diagnosed, I was only 19, so there wasn't really a lot of, I couldn't find a lot of information on the internet. So Honestly, I did a lot of trial and error myself.
After the event, the student panelists and 3 patients spoke with Steffens Foundation spokesperson Peter Meenan.
Sure. Well, before entering the program here at Sage, I was not aware of scleroderma, but I actually was at this event last year. So this is my second time learning about this disorder and getting to know some of the patients in our community, which I think is great.
Like my professor had mentioned it in the beginning of the semester, but I didn't really look into it until like recently, and even then I read the homepage of the Scleroderma Foundation website, so that's all I knew from it, but I learned so much from just being here tonight.
I wasn't aware, but I'm very glad that I came here to become very aware of what's going on.
Talking to the patients who are affected by scleroderma every day was a really meaningful experience, and just talking to them, listening to them about their everyday lives and how they manage their condition and how they learn, how they initially learned about it as well was very meaningful, and it's a lot of stuff that we can really take back into our own practice, especially for me as a nurse.
So I've done a lot of IPE conferences with Sage previously, and this one is a lot different, and I liked it a lot better because there was patients at every table. So we got to ask them questions and get to know them personally versus just kind of pretending that there was a patient there.
The patients being there in front of me was probably the biggest thing that helped improve my awareness, because we can learn about it in class and on paper, but to have a patient who's used to being around students and used to being asked all these questions, they're just completely honest, and you can really get a true idea of what it's like to be a person living with scleroderma.
Are there any suggestions that you have for improving this awareness program?
No, not really. I think the program is really great. Maybe more time for the students to have the one-on-ones with the patients, but that's it. I think that it went really well, and I think it's really great. I was here last year, so it's my second year, and I think that it's just very beneficial for all of us.
What do you feel are the benefits for patients and students in participating in this scleroderma awareness program?
Well, the benefit for me was just being invited, being able to participate. It's psychologically, it's a good benefit to help myself, being able to give back to the scleroderma community. I think it's like the least I could do. I got to learn a lot of aspects from the students on their perspectives of what they're doing in their education and how to benefit us as patients. In return for that, I was able to give them insightful answers of my specific things to help them.
You know what, I think it was really awesome because this was my first time coming, and I was just really grateful, to be here. Once I got here and once I sat and listened to the students, I was really grateful because they cared, and I loved that they cared, and they really made me feel comfortable, and they made me feel good.
If it wasn't for events like tonight, this rare disease might not have ever been introduced to any of you. My hope for the future is to look back on this event tonight and be able to say that this was a starting point. This was the event that started many other events in the future, not only here at Sage College, but nationally and fingers crossed internationally.